welcome to another episode of MedSynapse podcast series, where we delve into powerful narratives, cutting-edge insights, and transformative work in healthcare. I'm your host, Hetvi Shah, and today's episode is titled Scalpel Skills Survival: The Real Impact of Gynae Oncologists. It's a title that echoes not just precision and technical expertise, but also the deep emotional terrain a gynecologic oncologist works with every patient. Joining us is a pioneer in the field, Dr. Viral Patel, the first registered gynec oncologist in Gujarat, a seasoned robotic surgeon with nearly a decade of experience and over 1100 gynecologic cancer surgeries to his credit. His advanced expertise in cytoreductive surgeries, including HIPAC and PIPAC, has been a game changer in the region. So, Dr. Viral, it's truly a pleasure to have you and welcome to the show.
Hello, hi, thank you.
So, Doctor, let's start with the title of this episode itself, like Scalpel, Skill and Survival. It hints at the emotional and technical intensity of your work. So, can you share a moment or case that truly captures what it means to be a gynec oncologist?
Okay, it's really very interesting questions. If I say like what is my skill, I think in the simplified manner I can tell it ranges from 1 millimeter to 1 centimeter. So generally, what happens in our surgery, like we have a lymph nodes, and in the simplified manner, I can say in our body we have a blood vessels, and just beside the blood vessel or over the blood vessel, there are the lymph nodes where the chances of cancer cell spreads is very high. So generally, we need to remove that during our surgery, and they are very close to blood vessel, like even 1 millimeter or less than that. And if we miss that 1 millimeter also, it might goes puncture blood vessel, and the blood spillage will be there. And blood vessel is so powerful that it can spill the blood up to 6 feet. So that much pressure is there inside that, and we have to take care of that also, and we have to remove lymph node also. If I say in another word, like we have to remove all cancer cells also. We should not leave even a 1 centimeter or less than 1 centimeter cancer cells, because if we are removing every cancer bit, then the chances of survival will increase by 40 to 15 months. So to remove that even a 1 centimeter or 5 millimeter, we will go very radical. Sometimes we need to remove the diaphragm also, and we will remove the diaphragm to remove that particular tumor. So we are not leaving behind any visible cancer cells in our surgery. So that's what we are doing day by day, every day.
Yeah, I think that's incredible to hear, Doctor. So now in gynae oncology, we know early detection can actually dramatically change the outcomes. But what do you see as the biggest barriers to timely diagnosis today? And how can we as the medical community help to overcome them?
Okay. So I feel there is a lack of awareness, or might be the lack of awareness about the screening or vaccination. Because like sometimes what happen, people don't know is that symptoms is very scary or really that symptoms is alarming. So that is the lack of awareness or knowledge. So sometimes what happen in the ovarian cancer patient will feel vague symptoms like heaviness in abdomen, cannot eat normally, or the abdomen or tummy is full within a short period of time after starting the food, loss of weight, bloating, all of that vague symptoms will be there. And sometimes people will take it as acidity or heartburn. So they might miss. But I can give us some hint to not misinformed or misdiagnosed by that common acidity term. Whenever you have this type of symptoms more than 12 times in a month, then definitely they have to see any specialist, any physician for the further evaluation. And in endometrial cancer, sometimes patient, or most of the time, patient will have a spotting. Means after menopause, they will have a bleeding episode per vagina, and that they should not take very lightly. They have to take it seriously, and they have to see their gynecologist for that. And in the cervical cancer, most common symptoms is discharge from vagina. and that discharge is typically little foul smalling. And before that also, sometimes they will feel spotting or bleeding per vagina, or sometimes there is a bleeding from vagina after the sexual intercourse also. So that all symptoms they have to know properly, so that they can come and they can see their gynecologists or physician for the further evaluation and checkup. The second thing which I feel, there is a lack of awareness for the screening. Screening means like we have a two important screening for the female. One is for the gynecologic cancer is cervical cancer. That is the most common gynec cancer and second most common cancer in women in India. And the pitiest part is this is like detectable in very early stage by the screening. So every 3 year, we have to have a pap smear, or every 5 years we have to do a HPV DNA test to detect this cervical cancer in very early stage. And the most common cancer for the female, everyone knows breast cancer. Every 2 year mammography is recommendable for that screening. So last and least, but very important, HPV vaccination. Every 9 to 14 year of the age, every girl should take this HPV vaccine, because it will give a 95% up to 95% protection from the cervical cancer. So thank you.
Yeah, that's really insightful, and I think these little, what you see, early signs should not be missed by anybody. It should be very timely, and it should be caught in, and bridging that gap actually saves lives also, I would say. So, doctor, you work with many younger women who are not just fighting cancers, but also dealing with concerns around fertility and quality of life, because that's a bigger question when it comes to these kind of cancers. So, how do you personally balance aggressive surgical intervention with preserving these aspects for their future?
Okay, so really very important question in our field is actually the gynec oncology branch itself is made because of this issue, like as per my knowledge, because generally we have to manage cancer also, we have to manage fertility also, we have to manage woman health also.
Overall.
So the thing is like what happens when we get the cancer, and sometimes many times we feel that our patient will tell us we need to conceive one more baby, or still we have not any baby, we want to do a babies. So we have to respect each and every feeling, but and side by side we have to manage cancer also. So there is many factors in each cancer. Like we have three most common cancer: ovarian cancer, uterine cancer, and cervical cancer. And this all three cancers, there are many different risk factors where we can give the option of fertility preservation for that particular patient, and they can take a help of infertility expert to become a mother or to have a kid in the future after our cancer treatment. That is possible.
Yeah, I think it is really interesting to know, and it is really important also to be protected, like beyond survival also. Now, Doctor, looking at the bigger picture, how has the role of gynecologic oncologist evolved over the years? And are we seeing shifts in surgical approaches, patient expectations, or the nature of multidisciplinary care?
Yeah, definitely. There are many changes, many advances coming nowadays. If you see like previous data, like all of people know that like if there is a ovarian cancer patient, then definitely that patient is not going to live more than 2 years or 3 years like that, and the cancer is going to come back within 6 months to 12 months. But now with the understanding of the pathology and physiology of the disease, we are coming with the very advanced surgical technique where we are not going to leave behind even a 1 millimeter of the residual cancer tissue, and that is going to give us the tremendous benefit for our patients, and they are going to live, I think, more than 5 years or more than that. Even in the terminal stage 4B also, they are going to live without any complications after the long-standing surgery. And nowadays we have a minimal invasive surgery also, like robotic surgery, laparoscopic surgery, and that is also a game changer in the cancer treatment, particularly gynec cancer treatments. Because like we will admit the patient morning, we will do the robotic surgery, and we will discharge the patient on the same day or maximum by next day or within a 24 hours of the surgery. So that is the achievement, because after the surgery, minimal invasive surgery of the robotic or laparoscopic, patients don't have pain, they don't have that much complication, they don't have blood loss. So the recovery is super very fast. And I think my all patients will go back to their routine within a week after the minimal invasive surgery. And one more advances has also come in our field, that is particularly for the ovarian cancer treatment, hyperthermic intraperitoneal chemotherapy, and that is going to give a maximum overall survival benefit for the ovarian cancer patient who are going to undergo surgery. And we are going to give the chemotherapy during the surgery, and definitely that chemotherapy is going to come in the direct contact with the cancer tissue, and that's why there is a very high lethality for the cancer tissue, and it is at 42-degree temperature, and that's why there is a good benefit for the cancer patients.
Yeah, I think that's really interesting. And these advancements has just evolved. And as you mentioned, it's such a game changer over the years. So really interesting to hear about these advancements. So, Doctor, lastly, I'd love to talk about the emotional journey as well, because that is also really important to address when it comes to cancer treatment. So, cancer is not just about physical disease, there's a whole psychological landscape your patients might go through. So, can you speak to that and how your role often extends far beyond the operating table?
Okay, so like if I say our role starts before surgery actually, because like we believe in the early recovery after the surgery. So for that we will start rehabilitation before the surgery. If I can give a simplified example, like if you see the marathon runner or Olympic sports person, they will do lots of practice before going for that Olympic or before going for that marathon. So in the same manner, like our surgery sometimes extend for the 6 to 8 hours. No doubt the patient is going to patient is sleeping on the bed, but the heart is doing maximum efforts during that surgery, because there is a lots of pressure for the heart in that surgery. So in that manner, we have to increase that patient lung efficiency and heart efficiency, cardiac efficiency. So we do the pre-rehabilitation protocol for all of our patients. They will do the 40 minutes walking twice in a day. They will take a protein powder. They will do the lung exercises, spirometry before the surgery, so that there is a more recovery after the surgery. And even after the surgery, we second day itself, we make that rehabilitation. We put efforts in our physiotherapy team, and our physiotherapy team will encourage patient for the walking itself on the second day of the surgery. And that surgery sometimes goes on for the 6 to 8 hours, and even after that our patient will start walking on the next day itself. And sometimes that will be painful, but yeah, our pain management team will take care of that pain, and physiotherapy will encourage them, and they will start mobilizing on the next day itself. And generally when a patient will go home by fourth or fifth day after the surgery. And no doubt, even after that also, there is a continuous emotional support by our team, by patient family members, because patient might have some pain, some dyspepsia, they cannot eat very well, they might have some fatigue, but yeah, that will overcome by day by continuous support, emotional support, continuous encouragement. Yeah, like that.
Yes, actually, that's like a reminder that care just continues before, after the surgery as well, and that's really important. So, Doctor, as we wrap up today's session, let me tell you that this conversation has been incredible blend of clinical experience and heartfelt experience. So, thank you so much for sharing your insights with us today. And to our listeners, especially healthcare professionals tuning in, thank you for joining us on this powerful journey. And remember, if you're a healthcare professional eager to delve deeper into medical topics or have questions, do not hesitate to join us on the MedSynapse platform. MedSynapse platform is not just a resource, it's a dynamic space where you can connect with your medical peers, participate in meaningful discussions, and contribute to the ongoing evolution of healthcare. So until next time, take care.